First, I want to talk about this latest health challenge fad trend that seems to have caught the mainstream public attention. It's all over Facebook and social media. You've probably seen these ice bucket challenges. I'm talking about ALS, the ice bucket challenges for ALS, supposedly raising awareness. I always wonder what that means, raising awareness, making people aware that there's this disease called ALS, I suppose. Raising money, too, for the ALS Foundation. I'm all for charitable giving. I've got no problem with giving to charity and giving money away. I think that's a great thing to do. But the sad fact of the matter is we don't need foundations for health. We don't need to have an ALS foundation and a cancer foundation and a diabetes foundation and a heart disease foundation. What good have all these foundations done for us? We've had a heart foundation since the 1930s or 1940s, maybe. Has heart disease dropped? Have they done anything to affect heart disease? Have we got any improvement? No. We got more heart disease than ever before. Same with Cancer Foundation. Have they done anything to help cure cancer? To help reverse cancer? No. We got more cancer than we ever had before. Same with diabetes or any other foundation you want to name. ALS is no different. I'm all for charitable giving. No problem. Give charity. That's great. But we don't need a foundation or doctors or drugs to deal with ALS, or for that matter, any degenerative disease. This is so important, you guys. We don't need to be medicalized to deal with degenerative disease. And aside from the costs of eating correctly, whatever it costs to eat good food, and aside from the cost of nutritional supplementation and maybe the cost of getting a rebounder, we don't need a lot of money to deal with ALS or degenerative disease. Take the millions of dollars that this ice bucket fad has raised, according to ESPN business reporter, a guy named Darren Ravel. $23 million has been donated so far in this effort to increase awareness of ALS. Give me a little bit of that and I'll go tell everybody about ALS. What the heck is this about? Ice bucket challenge and donating money and to raise awareness for ALS? Take the $23 million and feed people. Take the $23 million and give people vitamin C. Pay for their supplements. Give people enough food so they don't have to go to McDonald's and they don't have to drink Coca-Cola. Lay off the McDonald's and Coca-Cola. That's how you deal with ALS, and that's how you deal with degenerative diseases. I'm being a little facetious here. There's a little more to it than that. The point is we can do all this ourselves. We don't need to have a foundation. We don't need to be medicalized for degenerative diseases. 5,000 or 6,000 people every year get ALS. But there's really no way of knowing whether someone literally has ALS. There's no specific diagnostic test for ALS. And you can't really separate ALS from other neurological diseases. Specifically, ALS, or the pathology, the disease progression or the disease development or the disease manifestation of ALS is a hardening, a sclerosis. Sclerosis simply means a hardening of a part of the spinal cord. And you can't tell if that's occurring until you do an autopsy. Doctors will give someone a diagnosis of ALS based on observation and based on this arbitrary assessment of nerve and muscle dysfunction. But whether the causes are literally sclerosis of the lateral, that's the side areas of the spinal cord, the columns of the spinal cord, can't be assessed. And at the end of the day, as far as health and healing and reversal and regeneration occurs, it doesn't matter. It doesn't matter if you have a diagnosis of myasthenia gravis or Kennedy's disease or Charcot's disease or amyotrophic lateral sclerosis or multiple sclerosis. These are all just degenerative diseases where the degeneration is occurring, but it doesn't matter. It doesn't matter where it's occurring. It matters that it's occurring. If we're interested in slowing down the progression or even reversing the progression, it doesn't matter where the disease is occurring. It matters that it's occurring. And this is so important. And it's what I call the bright side philosophy. It's what makes the bright side philosophy singular and unique in the world of health and healing. With all degenerative health challenges, when it comes to getting well, when it comes to getting better, it doesn't matter where the disease is occurring. It matters that it's occurring. For the most part, the diagnosis is only a description, and when it comes to healing, it doesn't matter. The body is a regenerating system. That's what we say every day on the bright side at the beginning of the program. The body is designed to regenerate. The body heals itself. ALS is a degenerative disease. The body's a regenerating system, but in ALS, we don't have regeneration, we've got degeneration, meaning that it's a disease that shows up in the body because for some reason the body is not regenerating. It's not healing itself, and the symptoms get progressively worse over time. And all we got to do is figure out why. Why is the body not accessing its regenerative capacity? Instead, it's degenerating. All right, hang tight. I'm Pharmacist Ben. We'll continue this when we come back from our break. You're listening to The Bright Side. And next week we'll talk about ALS. Speaking of ALS, you've probably seen all of these ice bucket fad, whatever you want to call it, people dumping ice on their head, football players and athletes and lay people getting nominated to dump ice water on their head, supposedly to raise awareness or to raise money for ALS. ALS is nothing more than a degenerative disease. It's arthritis of the spinal cord, really. It's a spinal cord issue, sometimes a brain issue, and it's basically sclerosis, or the deposition of hard, fibery material inside of nerve cells that are typically located in the spinal cord. That's pretty much it, you guys. And doctors will tell you that it's all mysterious and nobody knows what it is. But all you got to do is figure out why are these sclerotic plaques or these sclerotic fibers, these hard fibers being deposited in nerve cells. This is so important. Remember, all disease is cell disease, and ALS is no different. It's nerve cell disease. That's it, guys. Nerve cell disease. This is what we talk about every day on The Bright Side. All disease is cell disease. All disease is cell disease. And it all relates to toxicity, malnourishment, and a lack of oxygen, and then inflammation. Sometimes with ALS you get some mechanical trauma that initiates the inflammation. But basically you've got inflammation that's following toxicity, malnourishment, lack of oxygen, and perhaps trauma. It's just logical, guys. Cell disease, meaning something's messed up with the cells. What causes cell disease? Starvation, toxicity, and and suffocation. Suffocation, toxicity, and starvation. It's pretty much the same thing as all degenerative diseases. ALS or Lou Gehrig's disease or Charcot's disease. It's just a nerve cell disease, a neurological nerve disorder. ALS stands for amyotrophic lateral sclerosis. It's fancy science talk for muscles degrading from a lack of nerve energy following a hardening of the side, the lateral area of the spinal cord. That's it. Like all so-called diseases, it's nothing more, ALS is nothing more than a description of what's occurring. It's in Latin, of course, so our doctors sound really smart and we feel really dumb because we can't even pronounce the thing. That's why we call it ALS. Who can say amyotrophic lateral sclerosis? Amyotrophic, by the way, is just, it's a three-part designation. A, letter A, myo, M-Y-O, tropic. Amyotropic, meaning muscles aren't getting fed. A means without, myo means muscles, tropic means fed. Fed in this case refers to energy, nerve energy. Muscles aren't getting nerve energy, period. Secondary to sclerosis on the lateral part of the spinal cord. If you can't walk or talk or move your limbs or feed yourself or breathe, it doesn't matter if you have a Latin diagnosis. We need to understand what's actually occurring so we can correct the problem. So what is the problem? What's the real problem when you have ALS? It's a hardening, or in Latin, a sclerosis of the spinal cord. Period. That's it. Sclerosis of the spinal cord. That's it. Next question. What's causing the hardening? What's causing the sclerosis? If you or a loved one has been told they have ALS, has your doctor asked this question? Probably not. But that's what he should be doing. He should be saying, what's causing this hardening? What's causing this sclerosis? That's what a doctor should be doing. Not drugging us with an anti-inflammatory drug or an immune suppressant drug that's only going to put more burden or more stress on the body. The doctor should be just saying, what's causing the sclerosis? What's causing the hardening? Has he done that? Probably not. So let's help him out. I know doctors are brilliant. I know this. They're health geniuses. They're the go-to resources for all diseases. They're doctors, of course. They went to medical school. But maybe our doctor's too busy. Maybe he's too busy to figure it out or to inquire, so let's help him. Okay? All living organisms are made up of cells. The body is made up of cells. The spinal cord is made up of cells. Everything in the body is made up of cells. The lateral, the side of the spinal cord, lateral meaning side of the spinal cord, is made of cells. All disease is cell disease. And ALS is no different. It's a cell disease, and in this way it's no different from heart disease or cancer or arthritis or acne. The sclerosis, that's the ultimate cause of ALS, is a cell disease. It's a cell phenomena. It's the result of sick cells. In the case of ALS, the sick cells are located in the lateral, the side area of the spinal cord. And the hardening, the sclerosis, is the accumulation inside of those cells, those nerve cells, in the lateral area of the spinal cord of hard fibers, gristly kind of fibers. And these gristly kind of fibers interfere with cell function. That's basically it. Now, it can also occur in nerve cells in the brain, and all disease is cell disease. So wherever it's occurring, your nerve cells in the spinal cord or in the brain are secreting too much hard protein. So you get this hardening or the sclerosis of these cells that are living, throbbing, dynamic beings. They can't function when they get hard. And this ultimately causes the cells to deteriorate and die. So why is it that cells go haywire? That's the only question, really. Why is it that cells go haywire and start producing the wrong kind or excessive amounts of these fibers? Well, you know, if you've listened to this program, because we say it every day, starvation, suffocation, and toxification. And that includes sugar. Sugar is a toxin to the body after a certain point is reached. Excitotoxins the same way, like MSG. All of this leads to inflammation. And as I said earlier, inflammation can also occur following mechanical trauma. This is why football players and rugby players and boxers, people who get head trauma, are much more likely to become victims. But either way, it's a cell disease, nothing more, nothing less. At its most fundamental causal level, despite what you'll hear from the medical professionals, ALS is no mystery at all. It is the logical end result of sick cells. And in this way, it is exactly the same kind of disease or disorder or pathology that results in acne if it occurs in skin cells, or psoriasis if it occurs in skin cells, or arthritis if it occurs in joint cells, or macular degeneration if it occurs in the cells of the macula, or heart disease if it occurs in the cells of the blood vessels or the cells of the heart, or God forbid even cancer. All of these are cell diseases, and this demystification of the disease process is so important, because we look at the end result, we look at the symptoms, and we just think it's mysterious. If we don't work backwards and deconstruct back to the cause level, we're going to be stuck with this morass, this maze of symptoms, and have no idea what to do, and no idea how to deal with it, and we're just going to be stuck going to doctors who are just as ignorant as we are about what's happening, except they're ignorant in Latin. So they sound intelligent. Why would anyone go to a doctor for a degenerative neurological issue, except perhaps to get some pain relief or maybe some anti-inflammatory medicine? Has anyone ever heard of a doctor curing ALS? All disease is cell disease, and medicine is absolutely helpless, useless at the level of a cell.